Welcome to Living Well. We really appreciate you joining our program today. We have a very exciting topic that we will be speaking about, stroke and spiritual health. Our guest today is Emma Nelson. You're going to hear a personal testimony about her experience having a stroke and making lifestyle changes afterwards. What I do want to tell you is that this program is for educational purposes only. Of course, you're going to want to take some notes because there's going to be some very important information. But we want to let you know that we are not physicians, we're not medical doctors. If you have any questions that you want to ask of your medical doctor, you can do that. But we are not prescribing, diagnosing, any of that. We are only going to provide you with information regarding your health and your wellness. We will have an opportunity for you to ask any questions at the end. So if you like, you can put those questions in the chat box. We'll be happy to entertain them. But before Emma comes on, I want to share a little bit of information with you about stroke. Some fast facts about strokes. Did you know that when you have a stroke, the blood supply to your brain is reduced? In fact, there are times that there is a complete blockage that prevents any type of nutrients or anything from getting to the brain. Strokes are pretty common. About 200,000 cases occur per year in the US. That's a lot of strokes. It is treatable, so that's really good news, but you need to have lab tests and some imaging to help diagnose a stroke. Some of the symptoms from a stroke can last for several years. And did you know that people that are over 60 are at a higher risk of having a stroke? It is an emergency. Can be life-threatening, and it is very dangerous. 1 in 5 women, so as we look at the women that are on the call today, 1 in 5 women has a stroke. They're at risk of having a stroke. And so it's important for us to know that this happens more frequently than we probably really realize. We also want to tell you that when you have a stroke, you're at risk of having a recurring stroke. And that's important for you to know because many people think, oh, I've had a stroke, I can't have another one. But yes, 1 in 4 people are at risk of having a recurring stroke. And then also, stroke is the number 4 cause of death in women. Number 4, it kills more women than men, and more women die of a stroke than of breast cancer. Now, those are some facts that make you say, wow. And so what we want you to what we're talking about today is we want you to know the signs and the symptoms of a stroke, and we want you to act fast. Fast. If you see any facial drooping, arm weakness, speech difficulty, it is very important that you seek medical attention. In the healthcare profession, we say time is brain. What that means is it's important that we quickly act so that we can preserve and save the brain. So you want to call 911. You do not want to get in a car and drive someone to an emergency room. It is a medical emergency. And so now that you know that, we are going to welcome Emma G. Nelson, and she's going to share with us her experience of her stroke. And I'm going to just ask her a few interview questions, and then she's going to respond to them. So welcome, Emma. We're glad you're here today.
I'm so glad to be here, and thank you for the invitation.
So tell us a little bit about yourself, Emma.
Okay, first of all, I am the mother of 3 children. I have 3 daughters, all of which was born in January like myself. And I have 6 wonderful grandchildren. And I believe all grandmothers think that their grandchildren are wonderful, but mine truly are. And as well, for the past 35 years, I have worked for the Department of Children and Families. And I am a stroke survivor. So if you don't mind, let me just give a little praise dance on real quick here. All right, thank you.
This is exciting, Emma. I'm so happy to hear about, a little bit about you. But, we want to hear about what happened. It was only, 2 or 3 weeks ago that you had a stroke. Tell us what happened.
Okay, it was July 9th. Okay, basically, prior to that, for the past 2 months, I've been having like little dizzy spells, but me trying to diagnose myself via the internet, I was on there searching, if you need new glasses, is that possible you would have dizzy spells or whatever? But on this particular Friday, which was July 9th, I was out in the front yard. So anyway, something told me, well, take your phone with you because I was expecting someone. I had an appointment at 11 o'clock and they were coming to the house. So I took my phone with me as I took my dog out. And so the dog had done with something, so I went to get the shovel to cover it. So then I started stumbling. I got real dizzy. It was different from the prior 2 months. And then along with that, I had pain behind my right eye, a terrible pain. I knew something was wrong with me at that point. So at that point, I called 911.
So it sounds like this had been going on for 2 months or
Yes.
months. So as
Yes.
you were doing your self-diagnosing, and then it was not
Mhm.
until it became a true emergency that you had to call 911. Now, Emma, tell me a little bit about yourself. Now, you told me about the children and the grandchildren.
Uh-huh.
Let me hear a little bit about your lifestyle. Many times stroke happen for a reason. They just don't pop up. Sometimes it could be many things. It could be diet, it could be exercise, it could be many things. Tell me, what do you think might have possibly contributed to you having a stroke?
Well, I hate to tell on myself. Yeah, I know my eating habits for one thing, because my cholesterol was really high. Okay, I'm not a vegetarian, but I was eating beef at least 4 times a week. Taco Tuesdays, neck bones with yellow rice and green beans. It was my eating habits. And then as well, I think because exercising. The past 8 years, I've been working from home. So I'm constantly sitting at the computer, not really up and moving about. So I think a lot of that had something to do with it, but definitely my eating habits.
Okay. So did you say, and I want to make sure I understood you correctly, that you were eating beef how many times a week?
Do you really want to call me out like that? Okay.
I was the microphone kind of got a little fuzzy, so I was just trying to clarify.
Sure, right. No, at least 4 times a week.
Okay.
Yeah, at least.
Okay.
And so I did a little study on my own, and they were saying, a high cholesterol level could be because a plaque buildup in the veins, and that could, I'm just saying, I'm not a professional as, a doctor. I'm gonna stay in my lane. I'm gonna be a management analyst. But that was one of the things I do truly believe contribute to my having the stroke.
So, Emma, you bring out a very good point, because many people are working from home, sitting for prolonged periods of time, and they're not up and their blood is not moving. And as I was shared in the beginning, a stroke happens when there's a blockage, right?
Mhm.
There's not oxygen and nutrients getting to the blood, to the brain. So it sounds like for all of us, when we're sitting, we really need to get up every 90 minutes or so, move around, get that blood circulating. So eating and exercise are critical to making sure that we stay well. So let's talk about those symptoms that you were having. It sounds like it was dizziness. Anything else? Any other symptoms that you were having over that 2 month period of time?
You know what? Now that I think about it, and like I said, I was doing some research. Now, the stroke occurred in the back of my brain on the right side. And I believe they said in the area that has a lot to do with your balance, having balance. So I did notice that sometimes when I would be walking, I would kind of lose my balance, and I would maybe hit the door or do something like that. But I never thought that it had anything to do with a stroke. But now that I'm thinking about it, it's possible that that was a sign as well, because it did occur in that part of the brain that deals with your mobility and your balance.
And so many times we attribute losing balance to maybe the shoes we have on, or maybe not
Hmm.
attention. And those are subtle signs that were really, I'm going to use some warning signs. They were warning signs, really, to kind of
Right.
say, pay attention. And you were just thinking, oh, that's just, a little bit of off balance, a little bit. But I tell you, even when people lose their balance or fall, those are signs that the body's trying to tell us that something is going on. I've heard of more stories than ever of people who have fallen, and then within a couple of days, they either had a stroke or had a heart attack. So
Mhm.
when we fall, not expectantly, we should always try to inquire or follow with our doctor to see what's going on with our body. So Emma, as you talk about your stroke, and I am so thankful to God that you're doing so well that you can interview with me on this show. This is amazing. But there are people that end up with deficits, whether there's weakness in the arm or droopiness on the face or different things like that. So tell us a little bit about, I want to hear a little bit about your experience in the hospital, because there were some things that you told me that I believe our audience needs to hear about. So tell me about your hospital experience, because they did a few tests and things like that.
Yes. Okay. That experience was awesome. I have to admit, first of all, the doctors, everyone at the hospital, anyone that was involved in my caregiving, they really made me feel like they were concerned about me. On several occasions, I had them praying for me. I had everybody praying for me. You know, different procedures. I had to do an MRI. I was scared to death of going through there. But I tell you, somebody prayed with me. Another procedure, I had the technician, her last name was Nelson. I was like, well, since we both are Nelsons, do you mind praying for me? And she was, you know, she was glad to do it. Not only, you know, did they aid me with my, as far as it is related to my health, but my spiritual need as well was met during my hospital stay. One of my nurses, I actually told her that I sing, and she came to me one day. She was like, I have a song that I want you to sing, and I am currently learning that song. And she told me when I sing it, she want to know so she can come to my church and visit. So even though I was concerned about my health, I never felt as close to God as I have before in my life, but then during my hospital stay.
Yeah. So you have people praying with you, asking people to pray
Okay,
with
yeah.
you. So you were witnessing for God. Your story is his
Mm-hmm.
story. So it's wonderful that you're sharing as you're going through this in the hospital with others about who God is. That's so absolutely amazing. So they did an MRI, probably did some other tests just to kind of rule out what type of cancer
Several.
it was. Yes.
Mm-hmm.
And you were,
Okay, now, you know, I'm not a medical professional, so y'all have to help me out with that. I know it was one where they wanted to take pictures of my heart. So I had to goggle this stuff, and they wanted to numb my throat, right? So I'm goggling, and it wouldn't numb, it wouldn't numb, it wouldn't numb. So again, somebody prayed for me, and I tell you, it was over before then. On one occasion, and I'm gonna talk real quick. When I get excited, I talk quick. I got to tell everybody about my super seniors. My super seniors are a group of senior citizens at my church that is 62 years and older. I tell you, when I was getting ready to have my MRI, I was crying and I didn't want to do it because I didn't like being closed in. But they said, in order to find out if I actually had a stroke, they would need to do that. Well, just a few minutes before time for them to come get me, one of my senior citizens called and she prayed for me. Girl, I went through that thing with no problem whatsoever. None.
well, you know, so this is, we have to pause and say that prayer works. There's many times when we're in situations that the first thing we do, we want to get scared. But the first thing we really want to do, instead of panicking, we should pray. Instead of panicking,
Yes.
pray. And so, Emma, I appreciate you saying that because many times we're panicking and we're afraid and we're scared and we're like, what do we do? But actually praying and having someone pray for you is absolutely so amazing. So let's talk a little bit
Yes.
about deficits. Many times after strokes, you know, people have to go to rehab. They may have had a deficit, may have some weakness, may have some paralysis. So, you know, I don't mind. I don't know if you mind sharing, but did you have experience any of these?
Oh, not at all. I don't mind sharing it at all. I had none. They could not believe it. When they called me from case management to set up, I guess, for a health aide to come out to the house to help me, I didn't need that. The guy asked me, did I need a walker or a wheelchair or something? I needed none of that. None of that. No physical therapy. I tell you, okay, I got to keep my hands still. They test me several times. That was like, follow my finger, you know, and take this foot and run it up your leg. And none of that, people. None of that. I have no side effects now. I will be honest. The only thing, sometimes I can't really stand much of the sun and I feel a little tired. Sometimes that's probably because I'm trying to act like I didn't have a stroke, but I did. But other than that, nothing. As you can see, it's nothing wrong with my speech. But listen, I thank God for that because I do want to say that He have proven Himself to me. God has been faithful to me, and I'm thankful for that.
Well, you know, that's a blessing that you didn't need a walker, didn't need a kid,
No.
didn't need rehab, didn't need anyone to come into your home. That is absolutely a blessing. So as I was talking to you, Emma, you were saying, I've made some lifestyle changes. Let's hear about those lifestyle changes.
Okay, well, I try not to eat beef 4 times a week. Well, being honest, I am working on my diet. I'm choosing other things. I want to eat healthier. I've started back exercising. Okay, yes, I did join the gym. And then, once you notice a little change, you know what I'm saying? You see you lost a little weight. I used to stop going as much. I know I did. So, but I'm working on those things. And another thing, Jennifer, I'm dealing with stress. I'm learning things that I can't do anything about. Don't worry about it. Things I can't change. Don't worry about it. Because you have to realize I have a God, he can handle all of that as far as I know he's never lost a battle. So I'm not going to worry about those things. I'm going to pray about them, maybe be concerned about them, but I'm going to take them there and I'm going to leave them there and enjoy the rest of my life. That's my plan.
And I appreciate you mentioned stress, because we didn't mention that, but many people are dealing with many things that they can't do anything about. We can only take it to the Lord in prayer. And so, Emma, I appreciate you mentioning that, because oftentimes we're just like overloading ourselves with this information and things that we can absolutely, only God can do something about that. So I'm happy to hear that you're changing your diet, because, on this program for the last 25 weeks, we've been talking about counsels on diets and food and how to eat right, drink right, sleep right. And just a couple of weeks ago, we talked about the meat being in the diet and how it really isn't necessary. But I know that you're on a journey. And we always tell people, go slow and be consistent. Go slow and be consistent, because if you do everything at one time, it could be a shock to your system. And that is not healthy either. So we want to do all of that. And so, Emma, I know that it's been a spiritual journey for you. You mentioned that you went to church the following week and you had a testimony. And tell me more about that, about this spiritual journey that this stroke has led you to. Not that you weren't already spiritual, because we know you've been so active in the church for many, many years, as long as I've known you since you were 15 years old. So now I want to hear what's different. What's different?
I tell you, my praise has changed to 150%. As far as, I know that God is God. I understand that. But it's until you're in a situation where he really proves himself to you. Because it could have been different for me. I could have been paralyzed or had other deficits, as you said, but I didn't have any of that. And you know what? I seem to be happier. And I realized that things some things doesn't matter. Little things doesn't matter. What matters to me is finding my real purpose. And I believe I have found that. First of all, my purpose is to give God the glory that he is worthy of. Next. And then I want to share with people about the love of Jesus and how much he loves us and how he wants us to be saved. And then I want to be kind. I want to, you know what I'm saying? I want to help someone else. Sure, we want to have a good life, and we want a good job. We want nice homes, all of that stuff. But that is not my purpose. My true purpose is to tell others about Jesus and try to live my life accordingly. Jennifer, I'm going to stop. I'm about to praise and say, okay, I'm going to stop there. I'm done.
I think that, and honestly, if this has brought you to your true purpose, that is the most important thing, that we fulfill God's purpose for our life. The last question I have for you, Emma, is, what advice would you give to someone who's maybe struggling with lifestyle choices, or struggling with stress, or struggling with, just the things that could have been contributors to having a stroke? What would you tell them? How would you tell them to kind of, like you said, you've gotten there, you let it go. But what would be their first step that you would advise them to help move them from where they are to where you believe that God can take them to?
Okay, as far as health, I think the first thing, and I think you mentioned it, about how your body tried to let you know when something is wrong. Listen to your body. Pay attention what is going on with you. You know what I'm saying? It's giving you signs. Don't take it for granted. Stay in your lane. Like I tell myself, I'm not a medical doctor. Just listen to your body. Then, try to eat right, more healthier, exercise. And then most of all, I think too, if we work on our personal relationship with the Lord, that would be so good, because we know that he can handle everything. You know what I'm saying? Just take it to him. So that's the advice I would give. Pay attention to your body, try to eat right, exercise, but most of all, Build that relationship with the Lord and put your trust in him, and he will see you through because he truly works in our behalf.
I agree with you wholeheartedly, Emma. I know that the Bible says we're fearfully and wonderfully made in the image of God. And if we have that close relationship, and when we have that close relationship with him, he will tell us exactly how to care for our bodies. There is no question about it. There's many verses. Know ye not that your body is a temple of God, and he will lead, he will guide, he will direct us. Emma, I want to thank you so much for sharing your testimony today. It is, I have enjoyed speaking with you. It has been such a pleasure. I hope you will stay on because Emilyn's going to share with
Yes, I
us
will.
a little bit more about stroke and just kind of increasing our awareness of how we can prevent strokes, how we can recognize strokes, how we can respond to strokes. It may not be us, it may be a family member, it could be someone
Mhm.
else. The last thing I would say is when I was working in the hospital, there was a guy who talked about strokes all the time. And he says sometimes people don't realize that if you have hiccups excessively, that it could be warning you of a stroke. I had never heard that before, but I want to share this on this platform just in case you have a series of hiccups and you can't get rid of them. I'm not saying you're having a stroke. I would just say pay attention, right? Be aware because it could, your body could be warning you of something that is coming upon you. Thank you again, Emma, for sharing your testimony. Emilyn, that was an
Yes,
amazing testimony, wasn't it?
it sure was. It
Girl,
was fantastic.
wow. Let's hear what you have to say more about strokes.
So, you have covered quite a bit of what I was going to say, but anyhow, let me see. Am I sharing? Am I doing this right? I just want to say what a great testimony that was. I really enjoyed it, Emma. You were delightful to listen to. So, some of the things that Emma talked about, what she was feeling, are typical signs for stroke. So the signs for stroke in women or men is about the same thing. It's sudden. These sudden changes you need to pay attention to. Sudden numbness or weakness in the face, arms, leg, especially on one side of the body. That could be a sign of a stroke. Sudden confusion, trouble speaking, or difficulty understanding someone's speech or understanding your speech could be a sign of a stroke. Sudden trouble seeing in one eye or in both eyes, that's another sign. Sudden trouble walking, dizziness, as Emma was talking about, loss of balance, or lack of coordination. All of these things depends on where that blockage is in the brain. It affects these different areas. Sudden severe headache. Just out of the blue, you start having this sudden headache, a headache that you never had before. You need to take warning and you need to act fast. You need to call 911 if you have any of these symptoms or you know of someone who is having these symptoms. You need to act fast. And I said fast, and FAST stands for an acronym in the stroke world. When we talk about FAST, we are talking about how to recognize a stroke. So one of the things that we look for in a stroke victim is F stands for face. Look at the face. Is the face symmetrical, or is there a slight twist in the face? Is the tongue deviating, going to one side? Those are signs of the stroke. The part of the brain that's affecting, that the stroke is affecting, is causing that problem in the face, that facial drooping, we will call it. The extremities, your arms and your legs, the person gets weak, they cannot lift their hand up. You tell them to lift their hand up and they just can't. Or you even pick the hand up, it just flops right down. That's a sign of a stroke. It's this weakness. And that's A, stands for arms. S stands for speech. One of the things that some people have difficulty with is their speech. They cannot say certain words, or sometimes they cannot say anything at all. They're totally what we call aphasic. So therefore, When you ask them to say, what's your name? Something that they should know, they cannot express themselves. They cannot say. Difficulty speaking or no speech at all. And T stands for time. Time is brain. Because the earlier you can get attention at the hospital, your recovery increases. So what are the things you need to note? When you see someone having a stroke, or if you have a stroke, try to remember the last time you were normal. Keep that in mind, because when you get to the hospital, that's one of the things they will ask you. When was the last time you were normal? When was the last time you did not have these symptoms? When you were okay? Because from that point to the point of getting treatment is about 45 minutes. Certain things need to be done in the hospital. As I'm sure when Emma got to the hospital, they were asking her about when was the last time she was normal? When was the last time, when did you not have these symptoms? Because we can give you medication that can open up that part of your brain that the blockage is taking place. Because there are two different types of stroke. There is a stroke from blockage or a stroke from a bleed. So 85% of strokes are due to blockage in the brain. The majority of strokes today are due because of a blockage. And this blockage could be because of a blood clot, or it could be because of plaque. So a blood clot is because the blood is not circulated enough, and then start clotting, and then a clot can get to a part of the brain and cause a blockage, and then that part of the brain dies, and then it affects your ability to speak or move or what have you. Also, the other 15% of stroke are due to a blood vessel rupturing. So a brain bleed. That is when you have that severe headache, the worst headache you ever have in your life. If you hear someone say, I'm having a headache, this headache is so bad, it is the worst headache I ever had in my life, warning, that person could be having a stroke, and it could be a hemorrhagic stroke. So these people need immediate care. Do not drive yourself. You call 911. Why? Because when you call 911, they can come and they have medication, they have tools ready to help. So they can start helping you before you get to the hospital. Secondly, on the way to the hospital, this stroke can advance and get worse, and you might be in danger of yourself and others because you can pass out behind the wheel. So it's best not to drive yourself. Call 911 for help. As Emma was saying, that when she had to change her lifestyle, and that is so true. Strokes are caused because, as I said before, plaque building up in the blood vessel. How do we get plaques build up in the blood vessels? Because of high cholesterol. So we have cholesterol plaques that can break off and enter into the brain, go up to your carotids, go up to the brain, and block areas in the brain. Or you can have, because of a condition called atrial fibrillation. Atrial fibrillation is one of those conditions that can produce blood clots because the heart is just quivering, and because of that, the blood is not flowing as it should, and then it starts clotting. And small pieces of blood clots can break away as the heart pumps that blood throughout the body. Some of the blood goes to the head, and if clots are in there, it can damage the brain. So a diet is so important. Before I said that, I know Emma was talking about some of the different tests that she did while she was at the hospital. The first thing when you get to the hospital we'll do is a CAT scan. We take an X-ray of the brain because we are trying to determine if you're having, what type of stroke you're having. Is it a hemorrhagic stroke, or is it a stroke due to a plaque or blood clot? So we do a CAT scan. And if it is not a hemorrhagic stroke, then we know what to proceed, the procedure will be next. We will try to give you a blood thinner to help to dissolve that blood clot that's causing the blockage. And we will give streptokinase is one of the medications that would give you to help dissolve that blood clot in the brain. And I have seen where people come into the hospital, cannot move a limb, cannot even speak, and after receiving that medication, it was just like they just woke up brand new. They're able to speak, they're able to move again. So it's just amazing. Another thing we will do is an MRI. An MRI gives us a more detail of what's going on inside the brain. We can see different layers of the brain, and we can actually diagnose you better with a stroke. Emma talked about they put a tube down her throat. So that was a transesophageal echocardiogram. So we normally do that, we call it a TEE, to see if there is any vegetation. Why did you have that blood clot? Why did you have that stroke? Sometimes our the appendage, we have an appendage in our heart, just like you have your appendix coming off of your colon, you have this extra tube that comes off of your heart. The same thing in the heart, we have something called an appendage, similar to the appendix. And sometimes in that area, blood clots form in that area. So the doctors usually look to see if there are blood clots in that area, why maybe you had the stroke, or sometimes because of infection, it gets infected, your heart valves may get infected, and because of that, little pieces of tissue can break away and get into your bloodstream and also cause a blockage. So those are some of the things that we do. So I just want to talk a little bit more about diet. This is what everybody can do. Everybody can take change your diet, healthy lifestyle. According to the CDC, eating a low food low in saturated fats, trans fat, and cholesterol and high fiber can help prevent high cholesterol. Because as I said, we have those cholesterol plaques. Limiting salt or sodium in your diet can also lower your blood pressure, because high blood pressure, high cholesterol can increase your chances for a stroke. How can we prevent strokes? Physical exercise. One of the main things we can do to help ourselves is exercise. Physical exercise can help you maintain a healthy weight and lower cholesterol and blood pressure levels. It's recommended that you have 2 hours and 30 minutes of moderate to intense aerobic exercise per week for adults. How does exercise help? Well, when you exercise, several things take place. You dilate your blood vessels. When you exercise, we produce nitric oxide, which dilates the blood vessels and cause the blood to flow easily. What is blood pressure? Blood pressure is the force that the heart has to pump against the arteries to take the blood throughout the body. So if your vessels are dilated, the heart does not have to pump that hard against that force, compared to when your vessels are more constricted. Because when you are dehydrated, for example, we have what we call vasoconstriction, and due to vasoconstriction, this causes your blood vessels to get narrower, and the blood is harder to push through, to force through, and therefore that raises your blood pressure. So exercise helps with nitric oxide. It helps dilate the blood vessels. Exercise helps you to reduce weight, and also because with weight is another reasons people can have stroke, because most of the time people who are overweight, they are not as active. When you're not active, your blood tends to pool, and pooling of the blood causes blood to clot. Another thing I want to talk about is water. water is very important. Dehydration, as I just said, can cause vasoconstriction, and that can cause the blood pressure to go up. When you're dehydrated, we have a substance in our kidneys that is released called renin. And what renin does, it tends to hold on to sodium and water. And because it realizes that, that you're dehydrated, the body knows it needs water, so it's holding on to this. And this renin causes increased sodium. As we know, sodium is not good. Too much sodium can cause one of the causes for high blood pressure. So another thing that we need to avoid is harmful substances like smoking, alcohol, and drugs. Just being around someone who smokes, as the CDC says, is worse than smoking. If you inhale someone who's smoking. So if we can stay away from cigarette smoking or people who are smoking around, just let them know that, you prefer them not to, because it's affecting your health. So these are some of the things I just want to point out on what can cause, what we can do to prevent stroke, and just so we can be healthier. As I said, a high fiber diet, how can we do that? We can start by eliminating some of the foods that we're eating. Instead of eating, if we're eating refined foods, we need to get rid of those. White rice, we need to get rid of the white rice and exchange it for a higher fiber type of rice, like brown rice. Include something like quinoa in your diet. That's also high fiber. Oatmeal, those are all good things that we can use to increase our fiber. Instead of eating the white pasta, we eat whole grain pasta. All of these things help increase the fiber. Fruits and vegetables. Fruits and vegetables. Eat more fruits and vegetables because that's where lies the fiber. So let's take these things to heart. Thanks again, Emma, for your testimony. And if there's any questions, I did not look at the chat.
That was a great overview. I really appreciate you going back through it and just kind of sharing with us about, the risk factors and actually ways that we can prevent having a stroke, because it's really easier to prevent something from happening than trying to respond and react to it. But what I do like about it is that we can control our life. We really can. What we eat, what we drink, what we do, when we do it all to the glory of God, we honor God and we actually care for our bodies. I was looking in the chat and I didn't see any questions, but if there's any questions about stroke or any questions or anything like that, we'll be happy to answer them. In the meantime, I do want to, I want to acknowledge Moya, who's on the phone, and I want to acknowledge Alicia, who's on the phone. This week has been a difficult week for them. They've lost loved ones, and we're just so glad that they came on anyway today. So we'll include them in our prayers at the end. So any questions? Well, this was great, I must say. Emma, thank you so much for being with us and for sharing your testimony. I love the way you ended it about really our work right now is to tell others about Jesus' soon return, about his love for us and the way he cares for us. And so I'm excited that, that's really a charge that goes for all of us, because people are watching what we eat, they're watching what we do, they're watching what we say, they're watching us. We're always on stage. We're always on stage. And so now's our opportunity to show them that we serve a risen Savior. We serve a God who loves and cares for us so much. Any questions? I don't want to miss anybody. I don't want to miss anyone. So what we want to do now then is we just want to go ahead and any prayer requests.
Dr. Sankey?
Yes.
One question. Exactly, I don't know if I missed it because I came on late, but exactly which one of the arms And exactly where in the arm would someone, can someone be notified that a stroke is coming on?
So that's, really a lot of times it is just the entire arm is affected by it generally.
Oh,
Not like just the wrist or anything like that, but it's generally the entire arm. There's a weakness that you maybe go to pick up a glass and you drop it, or pick up a
oh,
plate or something and you realize like I didn't expect for that to fall out of my hand. It could be as a warning sign that that weakness may be something that is happening in the brain that's preventing the arm from functioning. So it could happen in the right arm, it could happen in the left arm, it could happen, either in your legs. It could even happen in your legs. That there's that weakness that comes on suddenly. Um, and one thing that I would warn for people who have migraine headaches, many times when you have migraine headaches, people just associate it with I have a migraine headache. But there's sometimes that migraine may be a warning that there's something else that's going on.
thank you, thank you.
Thank you. Good question. Any other questions? So I think the key message I would say for all of us, it could happen to us. It could happen to a friend. You could be in a store and not know, it could be a stranger that you notice this happening. And the reason that we did this program today is because it is important for us to be able to recognize it and respond quickly. Call 911. Do not try to say, look at your arm and see if it falls down. Don't try to ask people to smile to see if, if they have a asymmetry of their mouth. We don't want to diagnose. If you think they're having a stroke, it's possible they are, go ahead and call 911. It's better to get them to the hospital to get evaluated rather than trying to assess them in an area that we can't get treatment. I know that Emilyn mentioned this, and I hope you heard it. The sooner you get to the hospital, the better your outcome will be. The sooner you get there, right after you notice any changes, the better it will be. So be really mindful of that.
Thank you.
Okay. I see a Jesse saying lots of pain in legs, can't get up fast. They think it's inflammation. Is this true? Well, Jesse, I am not there to assess all what's going on with you. The best person to give you that diagnosis would be your doctor. So if they're saying maybe inflammation, maybe that's true. Inflammation is the root cause of so many different problems. And inflammation can cause pain also in whatever extremity or the part of the body that is affected, has been affected by the inflammation. So the best person to get that proper diagnosis or information is going to your doctor and have them do a thorough examination so that they can tell you exactly what is going on.
I agree. I do agree, because honestly, they're telling you that maybe they've done some studies to help diagnose that. That's really the best recourse. So we're going to go ahead and close out with prayer. We are going to keep Moya in our prayer. She lost her father this week, so continue to pray for that family. Last week we were praying for her father who had gone back to the hospital, had pneumonia. Moya, our condolences to you and your family. And then Alicia lost a brother this week, Wendell, and we want to, Alicia, please know that we're praying for you and your family. So again, we want to keep these families uplifted even after we get off the call. Pray for one another, right? You've seen the names, maybe you don't remember all the names, but just say whoever was on the call today, let's pray for them. Pray God's covering on us, because we know that, the devil, he goes out to steal, kill, and destroy. But God says, I've come that you may have life and have it more abundantly. So that's why we've been doing this on Sabbath afternoons for the last 26 weeks, because we want you to have the abundant life. We want you to live well. And so our program next week, you do not want to miss it. It will be on mental health wellness. And so Dr. Yvonne Sabalo will be our presenter. And she is a licensed therapist, and you want to hear her conversation about mental health, particularly now that we've been in the COVID for so many months. People are really teetering and having difficulty adjusting and adapting to all the things that are happening around them in the home, outside the home. but Yvonne will be our speaker next week. It's same place, same time. We're going to close out with prayer. If there's no other questions, I want to make sure that we answer them. Thank you again for joining Living Well. It is our prayer that you will live the abundant life that Christ promises in John 10:10. Shall we pray?